Hey, thank you so much for joining this session, Hope for a Sickle Cell Cure. We are going to get started. We have our great speakers already here and present. I think Malia is joining. Hold on. Malia, are you with us? Okay. Okay, thank you so much for joining us today. We are going to get started. If Malia is available, then we will definitely just chime her in. And right now, I want to just take the time to say we have some great speakers here and available. I'm Carla Lewis, founder of Kids Conquering Sickle Cell Disease Foundation, and I'm here privileged to have my friend, Dr. Marie Ojiambo. We have known each other for years, it seems like centuries now, and have been in the advocacy field. Can't even remember how long ago that we met, but we continue to just work together, and she has presented at our prior symposium before, as well as we have presented on other national platforms together before. So she continues to do awesome work in the community, as well as we have our awesome advocate speakers today. So Dr. Marie Ojiambo, I thank you for being here, and I thank you just for being a dedicated friend to me, that when I need to chat or ask questions, you're always available. I will allow you to tell a little bit about yourself, but first I'm going to allow Marjorie to do her welcome. Thank you.
Good afternoon to everyone. Welcome to the Sickle Cell and Chronic Pain Management Symposium. My name is Marjorie Tingle, and I will be your conference administrator today, along with Trinice Beaver. I welcome to the panel Dr. Marie Ojiambo. I welcome to the panel Dr. Malia Wallace, Christina, Augustin, as well as Mikiyah, Butler. Welcome, ladies. I thank you so much for being here.
Marie, can you just tell us a little bit about you, and then we will let you go into your panel discussion. Thank you.
Yeah, definitely. First of all, thank you for the kind introduction, Carla. Like Carla said, first of all, you're doing amazing things. Thank you for setting up this forum. It's been a crazy 1.5 years given the pandemic, and we weren't sure how we're going to meet for World Sickle Cell Disease. So this is something that we warriors have been looking forward to, and we just want to thank you and your team for putting this successful forum together. So as Carla said, my name is Dr. Marie Ojiambo. I am a doctor of pharmacy by training. I graduated from St. John's University School of Pharmacy some time back, and then subsequently went into preclinical practice. So right now I work as a formulation scientist. A formulation scientist just basically makes drug. We take inactive components, put them together with the active components to come up with a drug. And we look at various disease spaces, but sickle cell is one of them. Aside from that, as many of you might already know, because I'm very vocal about it, I am a sickle cell advocate. I speak, eat, breathe sickle cell disease. I like to educate patients. I like to educate the public. I like to educate young women like me who are suffering from the disease. So I just love to sit in this space. I feel like it's such a privilege and an honor. And such discussions are going to bring us, more awareness and education about the struggles that patients are facing, not only the struggles, but the victories. And this panel has a lot of victories and great stories. So we're ready to jump into it. Can I go ahead and jump into it, Carla?
Sure. I'm going to stop the share so we can see you better, Dr. Marie.
Okay. Okay, so today we are pleased to have, well, 4 panelists alongside myself. I'm not sure if Malia has joined, but I'm going to go ahead and introduce the other panelists, the other young ladies who are with us today, and they're just going to be giving us wonderful stories about their experience. So right here today, we have Christina Augustin. She is 26 years old, and she is a sickle cell advocate based in Fort Lauderdale, Florida. She has a Bachelor's of Science in Health Education from the University of Florida and a Bachelor of Science in Nursing from Duke University. She is a registered nurse and works as a bone marrow transplant nurse at Emory. So the wonderful factor about Christina is that in January of 2020, she began her own experience to get a bone marrow transplant and received it in November of 2020. So she's currently undergoing recovery, and she is sharing her story with other people to just empower them and educate them on the process. Okay. I saw my video went off for a quick second there. Can you see me now?
Yes.
Okay, great. So welcome, Christina. Next, we have Mikiyah Butler. Everyone calls her Kaya. She is a 21-year-old college student with a major in sign language interpretation. She has been at her place of employment for 7 to 8 years now, and her family actually bought the business that she works in. In her free time, she likes to watch documentaries, listen to music, and play Sims 4. Kaya has an incredible story. I cannot wait for you guys to hear. She is such an inspiration. Welcome, Kaya. And finally, I am going to introduce her, even though she's not yet here, or maybe she might be here, but Malia Wallace. She is based in Jackson, Mississippi. She was diagnosed with sickle cell SS when she was 6 weeks old. At the age of 12, Malia was granted the opportunity to have a haplotype bone marrow transplant in Nashville, Tennessee. Malia's transplant was a success. She only now has sickle cell traits, and she has been able to live life like never before since the transplant. She's also here to educate us. And this is a wonderful story because the haplo bone marrow transplant process is not something that's very common. So she's going to be here to demystify the process and just educate those of us who are looking at this option as a cure option. So welcome, ladies. I am going to jump straight into introductions. I said a bit about what I know about you ladies, but I want you ladies to come off your mics and introduce yourselves. Basically, in your own words, who are you, and what you stand for and what you're doing within the sickle cell space to advocate for other warriors and yourselves. So we're going to start with Mikiyah, go to Christina, and then we'll end with Malia.
Okay. Hi everybody. I'm Kaya. So like she said, I'm a 21-year-old college student, currently working at my parents' business as well. I would say that in order to advocate for sickle cell, I do a lot of social media posting. So I will post on my Instagram. So like the whole trial that I did is posted. I post on my Facebook sometimes as well. I make sure that I wear the shirts and clothes, and if people have questions, I always answer them. I always say no question is a dumb question, and all questions are welcome. So yeah, that's kind of it.
Okay, Kaya, can you tell us a little bit about what procedure you underwent? I know we have a few bone marrow transplant patients here, but yours is a bit unique. So can you tell us about what procedure you underwent?
Yeah, so I did the gene therapy trial. I went to Cincinnati Children's. And so basically what happens is they took my stem cells out. So I was essentially my donor. I didn't have to find a donor or anything like that. And they took a vector, which is essentially the HIV virus without all the bad things in it. And they put it in my stem cells in hopes that my body would make fetal hemoglobin. So I ended up getting a dose of chemo and my stem cells back. And since then, I haven't really had much pain from sickle cell. So with with the gene therapy, they're essentially, like I said, trying to make my body make fetal hemoglobin. And with sickle cell, your body doesn't create it, and that's what causes the pain and everything.
Awesome. We look forward to hearing more of that. All right, Christina, tell us a bit about yourself. Introduce yourself in your own words, and also what procedure did you undergo?
Hi, everyone. My name is Christina. Like Marie said, I'm 26. I'm from Fort Lauderdale, Florida. I went to the University of Florida and got a degree in health education. And then I moved on to Duke University and got a degree in nursing. I've always been interested in research. So like sickle cell is just something I've been researching my whole life just to get to know me better and know just the disease process a little better. So I went into bone marrow transplant nursing. I've been doing that for 3 years now. And in November 2020, I was able to get a bone marrow transplant on the floor that I work on. So that was cool. And so unlike Kaya, I had to get a donor and they donated their stem cells to me and they were transfusing to me. So I didn't have to do any like gene editing or anything like that. And right now I'm 7 months post my transplant and recovering.
Awesome, that's fantastic. Malia, are you here?
Hey.
Hi, how are you?
Hi.
All right, tell us a bit about yourself. Introduce yourself in your own words and let us know what procedure you underwent.
My name is Malia Wallace. I'm 17 years old. I recently just graduated from Murray High School in Jackson, Mississippi, and I had the bone marrow transplant. My dad was my donor. So, yeah.
Okay, welcome, Malia. It's a pleasure to have you. All right, so let's jump into our questions. A lot of sickle cell warriors have approached me, as I'm sure have approached these wonderful ladies that we have on the platform, as well as Carla, to ask, what are my options? Is bone marrow transplant an option for me? Is gene therapy an option for me? Is a haploid transplant an option for me? So for you ladies, what made you get to that point where you made that decision that I want to do this? A lot of times when we consult in the medical field, we find that patients who suffer moderate to severe sickle cell disease manifestations as well as symptoms are good candidates for bone marrow transplant procedures. So were your symptoms or was your quality of life significantly decreased for you to decide, okay, this is something for me and this is something that I want to go through? Who did you consult with? Was your family also part of making that decision? What brought you to that decision? We're going to start with Mikiyah.
So for me, I wouldn't say that my health played a part in it. Like I never was always super sick. Like I haven't had a stroke or anything of that nature. So I would not have qualified for a bone marrow transplant. So for me, instead, it was more so my relationships with other people that had sickle cell. And what it took for me was for me to lose 2 friends due to sickle cell. And so after my second friend had passed away, literally like a month after, the hospital had called me and they said, hey, we have this trial that you could potentially qualify for. Do you want to do it? And I was like, oh yeah, I'm all for it, because I took the standpoint that if it didn't work for me, they could figure out where it went wrong and help somebody else. So I didn't really, like, I went into it thinking about me, but at the same time, it was more so, what can I do to help find a cure for all of us? Because we're all going through it at the end of the day. And what can I do to help prevent other people losing their friends or family members from the disease as well? So that's what happened. I didn't contact them about it. They actually contacted me about it, and my family was behind it 100% as well.
How did they contact you? How did they get your contacts, if we don't mind asking?
So it was actually my nurse practitioner that called me. And I had a visit to Cincinnati, I want to say like a week before she had called me, and she was like, hey, by the way, we forgot to tell you, you're eligible. And I'm like, how do you forget to tell somebody that important information, you know? So they just already had my number, I guess, and they just gave me a call.
Okay. That's awesome. I like what you said, Kaya. You know, if it doesn't work for you, it will work for someone else. That's very noble also, especially because our community, colored people, we do face challenges as regards enrolling into clinical trials. So for you to be very selfless and say, if not for me, for someone else, congratulations on that. Thank you.
Thank you.
All right. Christina, what brought you to that point to decide that a bone marrow transplant was it for you?
So since birth, really, I've just about suffered every complication there is that sickle cell can cause. Just going from head to toe, when I was 8, I had a stroke. So it paralyzed like the lower half of my body. I was paralyzed for 3 months. I had to do intensive physical therapy. And from that stroke, I'm now deaf in my right ear. So I've been having to rehabilitate from the stroke for a couple of years. Then after that, I've had 3 retinal detachments. And in sickle cell, because of the tiny blood vessels and the lack of oxygen to your eye, it can cause like your retina to detach from the back of your eye. And your retina is what like produces pictures and allows you to see. So when that happened, all I could see was black. And it happened twice. So I had to have 2 open eye surgeries. And whenever you have an eye surgery, it can cause cataracts. So then after I got my vision back, I developed a cataract, and my vision was just blurry. So I had to have surgery to correct that as well. So that was now 3 eye surgeries. I had to have my gallbladder removed. I've had enlarged heart, fast heart rate. I've had vascular necrosis, and that's when like your joints decay. And that happened in both of my hips. So I had to have both of my hips replaced 6 weeks apart in 2019. So just a lot of things that happened that brought me to that decision. And like, I'm 26, these things are happening in my 20s. So I'm like, okay, all of these complications are happening in my quality of life. What is it going to be when I get older? How long am I going to live? Because all of these people around me are dying and suffering from these complications. So it was just a matter of time where I just, came to the point where I was just tired. I wanted more. So I reached out, started researching different trials, went to clinicaltrials.gov and looked up all the trials in the US, bone marrow transplants, haplo transplants, gene editing, anything I could find. And I reached out to every single one I had on my list and tried to get that transplant as soon as possible.
Wow, Christina, hats off to you. You're a fighter, and continue fighting. Yeah, continue fighting. That's an awesome story. We can't wait to hear more about that journey from you. All right, Malia, your turn. What brought you to that decision to receive your bone marrow transplant?
Due to me being a minor at the time, my mom had to have a conversation with me to see if I wanted to have a bone marrow transplant, and she explained it to me. So basically, like when I was younger, I was just tired of the pain, like every other day, like taking pain pills, being on a lot of medication. And like it was so much for me being so young, and I wanted to experience life without the pain. I got hospitalized every other week, 1 to 3 weeks at a time. And majority of my childhood, I spent in the hospital. So I really didn't want to live my life like that. So when I was young. So now I can live my life like I want to.
Okay, awesome. Thank you for sharing. So Mikiyah, yours is gene therapy, which a lot of people are still coming to the knowledge of. We're still learning a lot about this type of therapy and how it is meaningful to patients suffering sickle cell disease. Can you just walk us through the process from the point of enrolling to them taking out your stem cells to receiving your chemotherapy and then the post-surgical healing? How was that for you?
Yeah, so I say me and my mom. So I started the trial in February of 2019. So that was when we signed the consent. After that, I actually had to get a port placed because I never had a reason for a port, and I had to start doing apheresis for the trial. So I had to get a port placed. I had to start doing apheresis. After I did apheresis for a while, they ended up taking out my stem cells. I also had to get a fertility procedure done, just in case the chemo did anything to where I couldn't have children. And I also had to get a bone marrow aspirate done. And then I was able to go to the hospital to receive my stem cells back. And I was actually there for a little over 2 weeks, I believe. And part of that time is kind of foggy, just simply because I was on a lot of medications. I was on the chemo. So I remember some parts, not so much some others. And as I was there, the second day is when, no, second or third day is when I had got the chemo, and then I got the stem cells back after that. And then I actually was I was the youngest at Cincinnati Children out of the 3 participants to do it. I was the third. I was the first with sickle cell type SS to do it. And I was the first from the United States to do it because the other 2 participants were from Jamaica. And I was actually the first to leave the earliest. So I spent the less amount of days in the hospital compared to the other participants. So once my levels came back to where they needed to be, they let me go home. And everybody was like, wow, you got out of there pretty fast. And I was like, yeah, I did. And then I ended up getting my stem cell transplant in January of 2020. So, I got out on Valentine's Day of 2020. And we got out right before COVID hit. And so I was able to spend quarantine at home, getting my life back together. So I didn't have to like go back to work or anything like that. And I just had to do some follow-up like transfusions, but other than that, everything has been smooth sailing.
Okay, you did mention, aside from apheresis, that you did undergo a procedure to make sure that you have options in the future in case you wanted to undergo childbirth. And we did speak a little bit about it, but I'd like you to just speak a little bit more about that process, what it entailed, the discussions that you had with your medical team regarding, okay, I'm a woman of childbearing age and I might want to have kids later on. What are, the options for me? Because a lot of young women of childbearing age ask me, chemotherapy, is that an option for me? I want to have children later on, so I can have bone marrow transplant. So can you talk a little bit about that?
Yeah, so I actually, I don't remember what the options were for, like all the complete options. What I ended up doing was getting the ovary removed. So it's somewhere freezing in like Indiana or something, waiting until I'm ready to use it. But the hospital and the clinical trial team actually got the consultation for me. So I didn't have to like set up a meeting or anything. It was more so next time you're here, they're just going to come and see you. So they talked to me about all the options. They gave us a packet to look over and told us like, call us to decide on what you want to do. So that's pretty much how it went.
All right, thank you. All right, Christina. So what about you? How was the process from the time of, looking for your donor or finding your donor, through your admission, through the actual transplant process, the chemotherapy, and post your surgery? How are you doing?
So I started my process in January of 2020. At my initial appointment, I met with the doctors. There's a bone marrow transplant nurse coordinator. There's a research coordinator that's over a specific trial. And with my specific study, it was comparing the quality of life of a person with sickle cell who gets a bone marrow transplant versus the quality of life of someone with sickle cell who continues like just regular therapy, like hydroxyurea, any of the other FDA-approved sickle cell treatments, blood exchanges, just anything you do as a sickle cell patient, that's what they were comparing it to. And they gave me some consent forms, and it was like a thick packet that basically described the trial, all of the complications, the qualifications for the trial, because there were some qualifications that you had to have in order to be submitted into my trial. For example, you had to be deemed like to have a serious sickle cell disease. So you had to have gone through like a stroke or multiple pain crisis per year, per month. different complications of vascular necrosis. So I've kind of like ticked every box with those complications. So I was a good candidate for the trial. And after that, after I signed all the consent forms, the second visit, they basically do a lot of these testing. I had to do like an MRI of my brain to look at my brain activity, make sure there weren't like any complications from my stroke. I had to look at my liver because all the chemotherapies and biotherapies that you get during a transplant can affect, your liver and other organs like your kidney and stuff like that. I had to do like x-rays, like all this stuff. And then they didn't send that to a committee. So there's a committee over your specific trial and they have to accept you and they send the acceptance back to your team. So once I got accepted, after I did all my pre-testing, that's when they started looking for a donor. And there's a different team that looks for your donor as well through Be the Match. And so once they find your donor, they look through like this database of people that match your HLA type, your human leukocyte antigen. It has to be like, there's like 10 different antigens they look for. It has to be like a 9 out of 10 or a 10 out of 10 for them to go forward, at least with me, since it was a full match. And then after that, it took about like 4 months for me to find a donor. So when I found a donor, the donor then goes to like some donor center somewhere at like a mutual location, and they do like different blood testing, like HIV testing, make sure they don't have any cancers or anything that can go to you once you get their stem cells, because it can through the blood and things like that. So once my donor did that, they then notified me that the donor finished all their testing. And after that, then we set a date. So by that time it was like May. And then by August, my donor was ready to go. So between like August and October, they pretty much prepared me. I had to do like monthly blood exchanges just to get those sickle cells out so that the chemo didn't have to do a lot of work. And then in October, I did in vitro fertilization. So I actually got my eggs removed and frozen. So with that process, I had to do 2 weeks of fertility injections 3 times a day, different hormones. And then you go in every day and they check your oocytes and your different eggs and look at how they're maturing in order for it to be ready for removal. So I got my egg removal like the day before I started chemo. So it was a pretty tight schedule. And then that Monday I went in, I started chemo. I did 7 days of chemo. There were 3 different types of chemos and 1 biotherapy called a globulin, rabbit thymocyte globulin. I got that and 3 different chemotherapies. And then I got a day of rest. And then the day after was my transplant. My donor donated the stem cells the day before, so they were fresh. And I got it the next day.
All right, so post-surgery or post your transplant, how would you say, I heard you say that one of the endpoints for your particular trial was your quality of life compared to a person who's suffering sickle cell disease and is like on first-line therapies or chemotherapeutic agents. So how would you say your quality of life is post-transplant?
I'd say it's much better. I'm not going through like any serious complications. The only complication that I did have is something called graft versus host disease. So when you get a transplant from a donor, your body looks at their cells as foreign because they're looking like, okay, this is not your cells. Like, what is this? So your body like starts to reject and attack. So basically what happened with that, I started to get like this big body rash and like chemo burns. Like my skin was just like peeling off and started like my body was just starting over and rejuvenating in order to kind of like familiarize itself with my donor cells. So once I got through that point, I'm on like different antibiotics. So I'm on an antifungal, antibiotic, antiviral, because when you get a transplant from a donor, your immunity is very low. So I had to take like a lot of precautions, just so I won't get any infections or anything like that. So that's pretty much like the major thing I had to really worry about was not getting an infection so that it doesn't like throw everything off. And then besides my rashes and chemo burns, I didn't have any other complications. And then I went in every week, sometimes twice a week, checked my blood levels, and they constantly checked my sickle cell level and make sure it was going down appropriately until it got to 0%.
That's awesome. Keep feeling better.
Thank you.
All right, yeah, walk us through your process from, well, your father was your donor, so I don't think you had to look much, but the process of, getting into hospital, chemotherapy, the transplant procedure, and post the procedure, how are you doing?
Okay, for the procedure, but I had went to the hospital. I was located in Nashville, Tennessee. So that's where I did mine fit. And I went to the hospital. I remember because I was in the hospital for Christmas that year. So I really couldn't do much. So I had started getting my chemotherapy, and my chemotherapy was to wipe out my system, my everything. And so after that, I had to do radiation. And after the radiation, that's when I had my bone marrow transplant December 28th, if I'm not mistaken.
Okay.
And back in January of 2016, I think I was cured then. Yeah, I think it was January. So, but the only problems that I had after my bone marrow transplant was like graft versus host disease. Like I had like ulcers and stuff in my mouth, and I had but before my transplant, I didn't have cavities, but after my transplant, I got cavities in my teeth, and my hands were real swollen and everything. Like sometimes I couldn't walk, and they had put me on prednisone to make it like help make me gain weight because sometimes I wouldn't eat. They had to give me medicine for that. So after that, we had came home. I'm not sure what month it was. We had came back to Mississippi, but when we got back to Mississippi, like my feet were swollen. It was like I could barely move. So it was just a lot. But after all of that went over, I'm good now. Like I don't have any more pain.
Amen.
I can go, but I still have to be careful, like because you never know.
So you all mentioned something very interesting, post-transplant, the fact that you still had to take care of your immunity or your immune systems. And a lot of you are going through this process within a pandemic. Mikiyah started, well, hers just, her procedure started just before the pandemic. Christina was during the pandemic. Malia, I know yours was a bit earlier on, but you are living in a global pandemic and still trying to get better. So what challenges has living in the COVID era actually presented to you as a post-transplant or post-chemotherapeutic sickle cell warrior? Do you have to do things much more different than the regular patient or the regular person in terms of your masking habits, your social distancing habits, in terms of, self-care? What more have you had to do? Mikiyah, we'll start with you.
With me, I didn't necessarily have to do anything extra. So like how Christina said, she had multiple doses of chemo and stuff like that. I only had the one, and they wouldn't let me leave the hospital until my levels were back where they needed to be. So I mean, once COVID hit, of course I followed the masking and the social distance and stuff like that. And I really don't, if I see like my friends and stuff posting on social media out at parties and stuff, I'm like, I'll talk to you in 2 weeks. Like we'll see where you're at in 2 weeks. But for the most part, I haven't had to do anything extra in terms of that.
Okay, good. How about you, Christina?
Like I said earlier, I had to start on 3 different types of anti-infection medications. And so yeah, my transplant was right during the pandemic. From the moment I was in the hospital, I couldn't have anybody with me. They didn't allow anyone. So before, they allowed like caregivers and family members to visit, but since the floor on my floor, everyone was immunosuppressant, we couldn't have any visitors. So I technically went through it by myself with the support of my family and friends from afar. And then when I got discharged from the hospital, They basically said I couldn't go anywhere. I had to stay home. So like I got discharged like around mid-December. So, you know, things were opening up. So I kind of felt left out a little bit, but I couldn't go anywhere. I had to stay home for a couple months, only leaving the house to go to the doctor. And even then they had us like separated tremendously. So I'm coming off of some of my antibiotics now. I was also put on like some anti-rejection medications just to combat all of it. And right now I have to restart my whole vaccination schedule from newborn. So I'm currently getting all of the vaccinations done over. So once I'm done with that, I'll be able to, you know, go back outside and kind of enjoy life a little more.
Awesome. We can't wait to enjoy life with you. All right, Malia, what about you? Are you still on any anti-rejection meds? Are you taking antibiotics, antivirals? How has that impacted you living in COVID with, you know, being a post-bone marrow transplant sickle cell patient?
I'm not taking any medication, like no medication. Like if I have headaches, I'll probably take Tylenol or something, but I won't just really have to go to the hospital and get medication provided to me. So with COVID, like I was really worried about getting COVID. Like I barely went anywhere. Like if I did, it'll probably be up one of my friends' house. Like that was it. Like, I have a mask on every time I'll go somewhere. I have hand sanitizer in my car, in my purse. Yeah, I just take like extra precautions because I know what I have been through in the past, and I wouldn't want it to come and jeopardize me and make it harder for me in the future.
All right, good. Okay, so you've all talked about how gruesome the process was, you know, grueling the process was in terms of getting your transplant and the healing process. And to me, the first thing that came to my mind was medical expenses, from the test that you had to undergo to the fertility tests, to the actual procedure, to post the procedure, to the medication you had to take. I want to know if you felt like your insurance covered those costs effectively. Did the clinical trial team or the hospital that you were at pick up on some of these expenses? Is there anything that you had to pay out of pocket? Do you feel like all your medical expenses were reimbursed? If there was something the clinical trial team, the pharmaceutical company, or your insurance could better cover, what is that? Mikiyah?
So for me, since the gene therapy is still in trial phase, I got paid for everything. So I got paid for mileage since I was traveling from Columbus to Cincinnati. They paid for gas. They paid me for every MRI, every X-ray. They also paid for my port to be taken out and for it to be placed. Every surgery I've had for the trial, they've paid for. I haven't paid a dime. The only thing that I do have to pay for is for my ovary to be stored. And I don't think that's too bad, because it's only like I only have to pay every like 4 months or something like that. So it's nothing dented in my pockets or anything crazy. And they also, during my transplant, they also paid for a hotel for the full time that I was there, so that my mom or whoever was staying with me at the time could go to the hotel and take a shower and sleep or do whatever they needed to do there. So everything on my end was covered.
Okay, good to hear. Christina, what about you?
So my team put in a request to my insurance for it to be paid for. It wasn't paid for by my clinical trial. So my insurance took care of everything. As far as my clinical trial, I had to do like pain surveys, different surveys about how I'm feeling. So I got paid for each survey that I did. But as far as testing and things like that, I didn't get paid for anything else. And then when I froze my eggs, my insurance also covered that. However, I only had 2 weeks between when I started IVF and when I got my transplant. So it was a very like tight time span between that. So I had to come out of pocket in the beginning for my hormone injections. And like for each syringe, so I did like 3 syringes for 14 days. and like each syringe was like $500. So like just for 2 days worth of medicine, it was like $1,000. So I had to pay a few $1,000s for my hormone injections. But in the end, there are some grants and like foundations that pay for individuals receiving chemotherapy or any type of therapy that'll cause infertility. They have grants for that. So I applied to those and got approved for 3 different type of grants. There's one grant that pays for all the medications, and there's another grant that pays for the procedure to extract and freeze your eggs. And there's a different one that pays for storage for a year. So I got refunded for all of that, and that all was paid for. As far as storing my eggs, every year I'll pay about like $100 to store my eggs, but the first year is free.
Okay. Christina, you seem to have a wealth of information on how to, circumvent that whole process in terms of, you talked about jumping online and doing the research to find out what options are good for you, and even post your surgery, you seem to kind of know where to find the resources to, get the grants that you need. And that's awesome. We'd like to just hear about a little bit about more of those resources later on. And if you can share the same with us for any other patient who's looking for such resources, we'd definitely appreciate that.
Okay.
All right, Malia, what about you? Everything covered? Any reimbursements? Any costs out of pocket?
My dad was in the military, so our Army insurance covered everything, like including the condo that we were staying in, food, like everything. So we really didn't have to come out of pocket with anything because they paid for everything. Even if we out of pocket for it, they would give her the money back.
Oh, that's awesome. All right. Cheers to your dad. Tell him thank you for serving. Thank you for his service. All right. I want us to kind of wind down so that we can take some questions from anybody who has questions. And participants, if you do have questions, please feel free to write in the chat, and then we'll give an option for those who want to ask questions to our panelists to just jump off of mute and do that. But I want to know, knowing what you know now, would you go through this procedure again, knowing that, you had to spend endless amount of days in the hospital, knowing that you had to self-isolate, like Christina talked about, not being able to have family or friends come and see you in the hospital, your graft versus host disease, all those things that happen to you during the process and even after the process, would you still go through the same procedure? And would you encourage other patients suffering from sickle cell disease to do as you have done, knowing what you know right now? Kaya?
So I would do it again. I always say that I'm not gonna sit here and lie to y'all and act like everything was butterflies and roses. That chemo is like no joke. But they didn't, like the hospital, I will tell you the one thing that they didn't really describe well was that aspect. So I always joke on my Instagram and I say chemo 10 out of 10 would not recommend. But in order to have the life that I have now and not having to go to the hospital and get transfusions and all that, of course I would completely do it again. And I also have had conversations with some of my friends about doing the trial. And I tell them, I'm like, there's nothing you can lose by doing it. And I mean, they're always like, I don't want to lose my hair. And I was like, I would rather lose my hair than sit here and lose my life. And when I talk to my friends, I'm like, I don't know about y'all, but losing the 2 friends that we lost, like that was enough for me. So that's kind of my standpoint on it. I'm all for it. If somebody says, hey, I want to do this, I'm like, do it. There's no reason not to, if that makes sense. So
I like that outlook. I love that outlook. And participants, those of you who are not following Mikiyah on social media, I'd like to encourage you to do so. She has a very interactive space. She posts about her experience, especially most touching to me. After I first met her, I went onto her Instagram and saw the videos that she posted about her chemotherapeutic experience. And it's amazing. It's mind-blowing, to actually see someone go through that process and just come out of it the way you have. So congratulations, and keep speaking that positivity to patients who want to undergo this procedure. You know, yes, chemotherapy will kick your butt, but look at you now, look at where you are.
Right. And that's why I'm like listening to us just like explain the process. And I'm like, yo, I don't want to scare nobody, but understand that like we did go through that, but it was like it's over, like we're living now, you know? So it's like, it's going to be like that. And then you're fine after that.
I love that. Yeah. It's a phase to, you know, a bigger goal, you know, you just something that you have to go through. All right, Christina, knowing what you know now, would you go through the same process? Would you advise other patients suffering the disease to go through the same?
I would definitely advise other people to go through the same process. I'm a research junkie, so I've always researched transplants like years back from when I first heard about it. And just like read every study, every complication, everything about it, and just taught myself about it. Unfortunately, I think that like a lot of sickle cell patients are scared, and like they say, you know, like there's not enough out here for us, or like nobody's not doing enough. But I feel like a lot of us aren't doing our research. A lot of us aren't participating in what's offered. Like, you know, if there's a little bit offered, just do that little bit. Any clinical trial that I come across, I've been a part of. Any medication that's come out, I've tried. Anything, because I've just always seen that outlook for sickle cell, that, you know, it could reach new heights. We don't have to suffer. The bone marrow transplant process is hard. Like, I won't lie. Like Kaya said with the chemo, it was gruesome. I lost my hair too. I'm growing it back still. And during the process, I got really bad mouth sores. So like the inside of my mouth was raw from the chemo. Like my tongue was just covered with like patches. I couldn't eat. I didn't eat for like 2 weeks when I was in the hospital. I got fed through a tube. I couldn't talk. Like, it was so painful. But looking back, I would do it all over again, because now, like, I used to be in the hospital twice a month, once a month, in the clinic every day, getting my blood transfusions every month, like doctor's appointments, you know, all these hematologists, cardiologists, like everybody. It's, you know, it gets tiring, and your quality of life just declines as years go by. So like, why not, you know, go through something for a short period of time to have a long life afterwards?
Yes, and I like that you say that. I look at it as a drop in an ocean. What, you know, what is the 6 months that you have to go through compared to now you're 26 or your 40 years of life? Honestly, if you can do it, just, you know, soldier through it. So thank you for that. And, you know, I like the way Kaya said that, you know, it's not all rainbows and sunshine and butterflies. There is the difficult part to it. But in the end, I like to say it's not perfect, but in the end, it's beautiful. And your journeys have clearly been that. So thank you for that positive outlook too. How about you, Malia? Knowing what you know, is this something that you'd go through again, or recommend another patient suffering from sickle cell disease to go through the same?
If I had the choice to, I would go through this all over again, because now it's like I can do whatever I want, like whatever I want with, like of life. Like I don't have to worry about being in pain every day, or like I can go to the mall with my friends. I don't have to worry about catching a pain crisis while I'm at the mall, or being rushed to the hospital. Like, I feel like I would really recommend other sickle cell patients having a transplant. A lot of people are scared, but it's like you have to look at the outcome. You have to go through those stages to get where you want to be in life. Like, I had to go through this stage at 12 years old to be where I want to be now, and I'm 70. I would most definitely recommend it.
I love that. Thank you so much. And random question, which it just came up to me when you're talking about, you know, your chemotherapy and some of you still taking medications. Have you gotten the COVID vaccine? And if so, how was it? Like, any side effects, especially given like I know Christina is still taking some drugs, some medications. How has it been for you? And, what's your stance on that? Would you encourage people who have been through the bone marrow transplant procedures, gene therapy, haplotype transplant procedures to take the COVID vaccine? Mikiyah?
Yeah, I did get my vaccine. I got Moderna.
Good.
And after the second shot, I had it was literally the day after the second shot. I had chills and a fever, but that was it. And then it went away. And I have been fine after that. Yeah, so.
Good. Christina?
So I also got the vaccine. I got it about a month ago. So you get it for me at least, a month after you finish your anti-rejection therapy, just so it doesn't reject the vaccine or anything like that. And so my team basically told me that I was getting it. Apparently, the statistic is that about 75 to 80% of transplant patients who get COVID die from it, just because of the level of immunity. So it wasn't really a choice for me. So I got it as well.
Thank you for sharing that. I didn't even know that myself. Thank you very much for sharing. What about you, Malia?
I didn't have it, but I really didn't have any issues with it. I didn't have any issues. I took Pfizer.
Okay, awesome. That's great. I also got the vaccine. Yes, team vaccinated. Can't wait to meet y'all outside and hug on you and love on you, and hopefully next time we have this symposium in person. So I just want to open up to the participants, Carla as well. Does anyone have any questions for this beautiful, strong women? Do you have any words of encouragement? Do you have anything to say to them? Please feel free to jump off of mute and share. If you have questions, I don't see any questions in the chat as of right now. I just see some positive reinforcement and great words over there. But yes, if anyone has a question, please feel free to jump off of mute before we end the session.
So before that happens, I see a comment that says, as much as I admire your positivity and not everyone will have a positive experience with chemotherapy or medical procedures, I am speaking from experience of chemotherapy being used for other conditions. I think that when it comes to that, I don't think anybody wants to scare, I don't want to scare y'all with talking about everything that's happened or the bad things. I don't want to put out all negative stuff to be to make you then say, I don't want to do it. So of course I'm going to be positive. I'm going to let you know the good things that came out of it. I'll also let you know the bad things if you want to know it. But understand that my job is not to scare you away. Understand that yes, you may not have a positive experience with living with sickle cell. You don't have positive experiences. Living a normal life, you don't have positive experiences. So it's all about taking that step to understand that yes, I may not have a positive experience during this moment in time, but what is going to happen months after the transplant? While I was in the transplant having chemo, never in a million years would I have thought that I would have went to New Orleans, got stuck in a rainstorm, completely drenched, traveled back to the hotel, and it was an hour drive with the air conditioning on, and nothing happened. Never would I have imagined that, even going through the negatives. So I feel like you got to go through the negatives, have positivity, but also know that it's going to have a positive outcome, if that makes sense. But I don't want to just put bad stuff, and then somebody miss their opportunity for a life-changing type of thing,
I agree, Kaya. And yes, all our experiences are very subjective. From what you've heard from Kaya, from Christina, from Malia, it's all very different for each of us, but you never know what could happen unless you're willing to give it a try. It might be more painful than others. It might be easier than others, but honestly, you never know until you got to throw your hat into the game. You got to be that advocate. You got to be that patient who went through the trial to be able to see the other side of it. So thank you for that, and keep speaking like that.
Also,
Go ahead.
sorry. Also, when you join like the trial, you're not binded to it. Like once you sign that paper from the first consent form, you can always remove yourself from it. Like you don't have to continue to the end. So I would say book that appointment, like meet that doctor, meet with that team, learn about the trial, learn about that specific trial, all the good, the bad, whatever it is. From that moment to when you find your donor, to the moment you're in that hospital bed, you still don't have to go through it. When you get that chemo though, it's over. But the day before, like I started Monday, November 9th. November 8th, I could have been like, I don't think I want to do this, and I could have retracted myself from the trial. Like you're not buying to it. Like you can always remove yourself, but I say learn about it, go for it, and see what's out there.
Correct. Informed consent. Thank you for touching on that. So I actually see a hand up. It's my mommy. Yes, go ahead, Mom. My mom is Josephine Ojiambo. She's actually on the call. She's also a doctor. Go ahead. What's your question?
Hi there, Marie. And hi to all the panelists. I'm calling in from Nairobi, Kenya. It's a little late here, so I haven't put my camera on. But I just want to, first of all, congratulate each one of you for sharing what others may not be able to see right now because they haven't walked with you down that path, but for sharing hope. I think for me, that's so important. I think hope is what creates a future. And I thank you so much for sharing the truth about the therapy and also for sharing the after effect of it and sharing also your life before it. Being a mother and a caregiver, it also makes us positive. We also can see because we walk the journey with you. And at times, sometimes it's as if we too are part of the condition that you face. So for us, it's so great to listen to you speak about hope. And what strikes me is the strength of character each one of you has and your ability to say, I'm going through this for myself. It's so important for us as parents to be able to know that you have the strength of character to go through this therapy. I have a question. I'm calling all the way from Africa, and I'm wondering, is it possible that this therapy is accessible to children in Africa and to young people in Africa? There are very many here with sickle cell disease, many warriors, many who are going through periods of repeated hospitalization. Is it available? And if not, are there thoughts about availability? What can we do to begin to work together, clinical teams, warriors across the oceans? How can we begin to share information and best practice? And perhaps you would share the same with us. Have another panel discussion with warriors in Africa and just share what you've been through and give them hope too. Thank you.
Thank you, Mom. And I love that question. What can we do for the warriors across the globe? I know Carla is planning to do something in Jamaica, her home country. And Christina talked about all the resources she has. So Christina, I'm going to reach out to you and kindly share those resources in terms of enrolling in clinical trials. I do believe that if there's a clinical trial that our other patients across the pond can just start to begin to ask the questions and reach out to doctors, reach out to not-for-profit organizations, reach out to pharmaceutical companies. I'm pretty sure in the same way they took up your treatment and did the reimbursement and made sure that you're there and available for the trial, I'm pretty sure that these options are available to our warrior sisters and brothers from across the pond. So that's a great question. And Carla and I, that's our challenge. We will definitely look into it. All right. Go ahead.
I was just going to say thank you so much, Dr. Maria Ojiambo, and all of the ladies that you've brought into our panel today. You guys truly inspired me. I was just so moved by hearing your stories and just you speaking your truth and sharing with all of our attendees and families who have challenges with family members who do have sickle cell. So I applaud you all, each and every one of you. I'm sure it was, very heart-wrenching to endure, but the fact that you continue to just keep the path and just continue moving forward despite the obstacles that you went through. I thank God for each and every one of you, and ask that God continues to bless your lives richly.
Amen. Thank you so much for that, Marjorie.
And thank you so much.
I want to piggyback off of that. More life to you, just keep speaking about it. You've also challenged me personally, being in clinical science in the medical field. I am going to start looking for more patients and talking to them about your stories, and continue to advocate on our social platforms. We love you, ladies, and we continue to wish you life and success.
Yes.
Thank you. I know we have some questions coming in the chat, but it's time to come into our next session. We didn't even go through a break. I know this particular session is so interesting, and was a learning experience for us all as we move into different curative therapy options and want to learn as much as possible. So I thank everyone for joining this particular session, and we're going into our next session. We didn't get a break, so we're going to chime into the next session. Our speakers are actually there waiting. And I thank you, ladies, every one of you, Dr. Marie, Ojiambo, that hats off to you always, and Mikiyah, and Malia, and Christina, how much that you have my heart, and I love you, ladies, and I thank you so much. And we're going to continue to have a voice out there for those that are interested in curative treatments, definitely using other times of platforms to be able to voice that. So you will be seeing these ladies, because we will be working on a future project. So tune in. There's definitely more work to do when we're talking about advocacy and learning more about sickle cell and treatment options. So thank you for joining, and we're going into the next session.
Bye-bye, ladies.
Thank you.
Bye. Thank you.
Bye.